I would like to recognize and I will gladly give up the spotlight to Joanne Marqusee, who's the president and chief executive officer of Cooley Dickinson Hospital. Joanne's professional experience includes over 30 years of leadership roles across a range of healthcare settings, including community hospitals, academic medical centers, public hospitals, and government agencies in both Eastern Massachusetts and New York. I'm just so thrilled to be able to recognize Joanne and to embrace her as part of our community. Her degree is she has a master's in public policy from Harvard. They were another university there. Harvard University's Kennedy School of Government. Joanne will be sharing with us how the Cooley Dickinson Hospital, our community hospital, is protecting us. There'll be some questions have already been submitted to her. There'll be an opportunity to put your questions in on the chat online, and then also there will be an opportunity if you could press the hand sign that's at the bottom of your screen, and maybe Nina, you might be able to tell them where it is because I can't see it personally, and we will be responding. And hopefully this will be 30 minutes of question and answers and hearing from our community leaders. Now, Joanne, we would love to have you hit the spotlight screen. And thank you, welcome so much from the bottom of my heart, because we have so many questions and so many concerns. And this is the cohort that is most affected by this virus. We'd love to hear from you.
So thank you. Can you hear me okay?
Perfect.
Great. So first of all, I want to thank you both for inviting me to come. We actually are looking and seeking ways that we can get our messages out, know what people's questions are, know what their concerns are, because we are more than, quote, just a hospital. We see ourselves as the major healthcare provider for our community, and this is certainly more of a public health crisis than any of us have seen. But I also want to thank you for all the work that your organization does throughout the year, which is so important in keeping our community healthy, and particularly the older adult population. So we are thrilled to partner with you in lots of ways in normal times and in these not so normal times. So just to give you some information, I thought I'd tell you about the trends we're seeing in COVID, talk about testing. I know that's always a big source of concern and confusion. Tell what we're doing at Cooley, what we're doing in terms of community outreach, and then end with what you can do, because I always give assignments at the end. You don't get out of here free of responsibility. So in terms of the trends, I want to note that you see a lot of data in the papers and on social media, and just to be careful about how you interpret it. So if you look at total number of positive COVID tests, that's going to continue to go up, and it may go up fairly quickly because we are not just testing the same numbers all the time. So we have to be careful not to draw conclusions based on how many tests are done each day or how many positive tests we have, because that can just be we did twice as many tests one day, or for example, this past week, there were 2 or 3 days where we tested a whole bunch of nursing home staff and residents. So that obviously drove up our positive numbers. So it doesn't necessarily tell you what's going on in terms of spread in the community. And until we have universal testing, which I think will not be very soon, we won't be able to use testing to really know what is going on with the virus spread in general. So what we look at to get a sense of where we are in terms of virus spread and where we are in terms of the curve and the surge is how many inpatients we have, on the theory that of every 100 patients who are positive, a certain percentage, luckily a small percentage, but do have to be hospitalized. So we were seeing that number starting to go down a little bit, and we were sort of like, oh, right, maybe we've passed the surge. Maybe we're starting to get to the other side. But then in the last several days, that number has started to creep back up. And that is in part, but not completely, because the nursing homes in our area have had some outbreaks, and that really drives the numbers. Now, all of this is better than what we predicted or what was predicted for us a month ago, 6 weeks ago, where some of the analytics or the sort of scientists who said, well, if things happened here like they happened in Italy, what would we see? And that was quite frightening, and showed that we would need to quadruple or more our ICU capacity and our entire hospital capacity. It wasn't clear that we could ever be able to surge or increase our capacity as much as we needed. We haven't seen anything like that in terms of the trends. So even when I say in the last week it started to creep back up, it's still a quarter of what we thought when it was the worst case scenario. And I think that is in part because we're in a relatively rural area, but also I think it's because our community has done a reasonably good job, and we had time in a sense before the outbreak to do the social distancing, the hand hygiene, and the wearing masks, etc. So that's to say we should keep doing that, because as you may know, from time when you get exposed, it can be 14 days before you're sick. So even if we start to see the numbers go down in the next week or two, it is definitely not the time to relax on any of those requirements. And I just saw this afternoon that the governor has actually gone from guidelines recommending masks to mandating that everybody, when you're in any public setting and can't do social distancing, wears masks. And I'm actually grateful that he did that. I think it sends a much clearer message that this is clearly helpful, and how can we really let people just not follow those procedures when we know that it keeps us all safe. It's not just about the person wearing the mask. So that's kind of where we are in terms of the trends around the virus spread in inpatient. So today, just to give you an example, we have 15 patients in our hospital who are COVID positive, and a number of others who test negative but look a lot like COVID. So tests are not perfect, and certainly when you have a new kind of virus, the tests are even less perfect. So we also can't even be sure that someone who's tested negative is negative. So another reason to follow all those procedures. You really have to assume everybody you know could be an asymptomatic positive patient, and then act in that way. So testing has been expanding, which is good. It was really limited at the beginning. So as our capacity to test, which requires certain personal protective equipment and requires different sets of supplies, et cetera, as we were able to do more testing, we expanded the criteria that somebody has to meet to get tested. So now in the last week, we've expanded it so that includes anybody who's symptomatic with a referral from a primary care provider can get tested. In addition, we're testing all of our patients and our inpatients, including all of our mothers who are coming to deliver, symptomatic or not. And then in certain congregate settings like the nursing homes and the shelters, we're testing everybody regardless of symptoms. So if you have symptoms or you're concerned and think you might, you should call your primary care provider, and they will then do the referral. And we have a drive-through testing area right behind the hospital, and once you would get an appointment for that, and they would tell you how to get there, and you literally stay in your car, someone comes up all suited up, looks like an alien in some movie, and they will do your testing in the safest way. And typically we get results back in about a day, which is helpful. And just to put a plug in both for testing and for everything I'm talking about that we can do at Cooley, if you're not already on our patient portal, I would encourage you to get on that. First of all, you can get information there about COVID, but also it's such a good way to be able to communicate with your doctors. And soon, it may have actually happened the last couple of days, that if you have a visit with a doctor, you could do it right in the portal by video, which I think is much better than doing it by phone or trying to do it on a separate video. So if you haven't signed up and you need any help signing up, we can get you that information. So we are doing anywhere between 50 and 80 drive-through tests a day, but doing more like 150 to 200 tests in total, because as I said, we're also testing at the nursing homes, and we also test our inpatients, and we test a number of staff every day. So what are we doing at Cooley to actually provide care during COVID-19? So as of several weeks ago, we have a universal masking policy. That means every employee, whether they're clinical or not. And so I actually have my mask. I get a new mask every day, and I wear it except when I'm in my office by myself. So even when I go out to the restroom, I put on my mask. And in order to get a mask at the limited number of entrances we have, staff have to complete a health assessment screening to make sure they don't have symptoms or they won't be allowed in. So all of this is both to protect our staff, but also to protect our patients so that you know if you do have to come for care, you can feel that you'll be safe. We also have done tremendous work to get the PPE, personal protective equipment, for our staff so that they can provide care safely and also not spread the disease if they are asymptomatic positive. And so right now we feel like we are pretty good in terms of having the PPE we need, but that includes, there are things that we reuse. We're lucky enough that we launder our own gowns. Many hospitals are really struggling with having enough gowns because they use the paper kind. And we have a system in Boston where we send our N95 masks every day and they decontaminate them. So lots of new creative, innovative ways so that we can conserve PPE, because this is going to be many, many months, if not longer, of much higher usage of PPE than anybody has ever seen. So we take that very seriously. As I mentioned, the early predictions were to have to really expand our capacity. And so we figured out if we had to, we could have gone from our typical 7 or 8 ICU patients to caring for as many as 28. And we had rented all sorts of vents and reallocated vents that are typically used in the ORs. So in part, because we had closed down all of our elective procedures, we were able to redeploy staff and equipment and supplies so that we could care for the sickest patients if needed. And then in terms of our outpatient services, we have established a special clinic called the Respiratory Infection Clinic, known as RIC, so that patients who do have respiratory illness can go there. And people who do not have respiratory illness and perhaps it's not appropriate to do a telephone or a video visit can go to their primary care provider or their specialist and not expect to see people who are coughing or have respiratory illness in that clinic. So we're trying to do as much segregating of the populations as possible, again, to prevent spread. So we're doing probably of all of the average number of outpatient physician visits we would typically do, we're doing maybe half that number, and 80 to 90% of that is through the telephone or through video. I think the main message I want to give about what we're doing is, and it's a sort of nuanced message, while we don't want people to come to the ER if they don't need to, and we want people to, as much as possible, stay at home, we are concerned that people are taking that too far and not coming and seeking care when they are sick. And so, for example, you wouldn't want to, if you had belly pain, say, gee, I don't think I should go to the ER, I might get COVID, I'll just stay home, and then you have a ruptured appendix. Or you might be having symptoms of a heart attack or a stroke. The ER is safe. Again, we segregate those with respiratory illness, and it is much worse for you to not seek care. And certainly there's no reason not to seek care from your doctors, because they can do that care through video if necessary. And even physical therapy we can do for some patients through video. So please do not, there's lots of other illness in our world besides COVID, and that didn't go away, and we need to continue, and we want to continue providing that care. In terms of visitors, this is probably, for us, something really hard to do is to restrict visitors. When people are in the hospital is the time they most need to have their loved ones there. But we made that decision, and I think every hospital in Massachusetts did this because it was so important to prevent spread. But so we do not allow visitors to our inpatient units, with a very few exceptions. For women giving birth, they can have one person with them. It has to be the same person the whole time, so you can't switch out between husband, partner, and grandma. And similarly on inpatient, if someone is end of life or someone really can't communicate or understand, we would allow, and there's a process to allow for that exception. But in general, we provide iPads to all of our inpatients so that if they are able to communicate, they can at least do that. And the nurses and our staff are trying to do all they can to make up for that, but it's certainly not like having your loved one there. So then just to turn to community outreach, as I said, we see our role well beyond just providing the actual medical care. We have a call center, a COVID call center that people can call at any time for any questions, and it has both clinical staff and other staff there. If somebody wants to know, how do I get tested? If somebody doesn't have a primary care doctor, if they want more information on how to self-isolate or what to do with their kids, how to explain these things, whatever the question is, they might not know the answer, but they will get you it. So, and we'll make sure to get that phone number out to you all. And we have put lots of information on our website, try to push out a lot by social media. So if you follow us on Facebook, both information about what Cooley is doing, but also there's sort of so much information, some of it true, some of it not so true, some of it outright lies, that we're trying to be a place where you know you can go and get credible information. You know, if Mass General gives us information about the latest science, the testing, all of that, we post that for you. And then there's how the community has supported us, and I have to say it has been unbelievable and incredibly gratifying and incredibly important to our staff, who are just doing such amazing work. And to know that the community recognizes that and appreciates it really makes a difference. So all of the notes we get, the postings, the signs, I came home one night and someone had put a sign in my yard. It was so touching. Thank you to Healthcare Heroes, which I don't consider myself one because I'm not on the front line, but it was still really nice. And then certainly the donation of supplies, donation of food. People are every day making sure that at least a couple of our units are receiving food from restaurants has been great. And then some wonderfully generous financial donations to our COVID emergency fund. So all of that is helping us survive financially, make sure we have the supplies, and survive emotionally, which is obviously hard for everybody, including our staff. So as I said, you don't get out of here without assignments. So what can you do? And I know this isn't new, but I have to say it. The way you can most help Cooley is to reduce the spread so that we have the capacity to meet the healthcare needs of our community. So social distance in a really serious way. Do hand hygiene more than you've ever done. Wash all your surfaces, wear masks, and seek care if you need it. We do not want people getting sicker than they have to at home. And if you're worried about having COVID, again, reach out to your primary care physician who will help you figure that what next to do. So with that, I am more than happy to take any questions, hear concerns you have, comments, anywhere we can help you more.
Okay, Nina has, can you and Joanne, can you and Jeff look at the chats? There might be questions on the chat.
So I can start with that. And Jeff Harness, Director of Community Health and Government Relations at Cooley Dickinson. And I'll say hello to everybody. And first, why don't I give out the telephone number for the call center? You can also go to our website. You can call 1-888-554-4234. And Joanne, the first question in the chat is, are there limited hours for the drive-through testing?
Yes. Do you remember what they are? Are they 8 to 6, Jeff, or 9 to 6? But again, but again, I want to make clear it's not a walk-in center or a drive-in center. You have to make an appointment. So you'd have to get a referral from your primary care physician. They would put the referral in, and somebody would then contact you to make that appointment and let you know what's available. Over the last several weeks, we have been able to accommodate everybody who called that day or the next day, depending on what time they called, unless the few days where the weather was so bad, and since it's an outside tent, we had to close down. But so there's not a delay in getting it, and they will usually be able to give you lots of choices that meet your schedule needs.
Joanne, the next question is, what is the accuracy rate for testing?
That is a really good question. And I would say that if you ask 10 scientists, you will get 10 different answers. This is what it means to have a novel virus. So no one really knows. We know it's not 100% accurate. And whether it's more accurate if you're symptomatic, whether it's more accurate if you've had it longer, I wish there was a better answer. But this is why if somebody has symptoms that look like COVID, even if they have a negative test, we treat them as if they had COVID, and we don the PPE. Staff protect themselves as if they have COVID. If staff have been symptomatic and out for a while, we have them do 2 tests, negative tests, before they come back in. So I think we're just going to have to see over the next several months as there's more research. But it's certainly, it's not more wrong than right. So it's better than 50%, but it is not 100%.
And
So
while we're talking about testing, can you tell people if we have a test for immunity?
So there are research being done and sort of some research studies being done on some immunity tests, serology testing, but they are certainly not ready to be used in any meaningful way yet. And there's really 2 things that research is looking at. One, how accurate will the test be in terms of knowing whether the person has been exposed and has that biology in them. But the second question is, how long and if having had COVID makes you immune for the next time. So think about the flu. We all sort of know you get the flu vaccine one year, you have to get it the next year. So is that what's going to happen with COVID? So I think it's really important, because to really understand when we can start getting back to whatever the new normal is, we'll have to have a sense of how widespread immunity is. And we're proud that we're part of Mass General, because they are actually leading some of these early research protocols to figure out what the testing is. So, I've never seen so many researchers from throughout the country. I know researchers, and nobody is doing anything but COVID related. So if there was ever a time we could get a test quickly, that doesn't mean days, that means months, but at least that and a vaccine quickly, this will be it, but it'll be slower than any of us want.
There's some nice comments on the chat, which we appreciate very much. There's a question about food for staff and how does one go about that, and someone has answered feed the front lines. There's a website on the chat. Joanne, the next question for you is, do you recommend that we get oximetry devices to check oxygen levels for people who are pre-symptomatic?
Well, I guess all I can tell you, and I'm not a worrier, and I don't usually run to do these things, but having read a lot about this, I did buy one. So it was $8 on Amazon. And I just thought, for me, I read enough to know that there are cases where people are not really symptomatic yet, and yet their oxygen rate was going down. Is that common? Is it not? But it just seemed like for $8, that if I ever was up at 3 in the morning worrying about it, that at least I had this pulse oximeter. So that's my, I'm not a physician, but that's my sort of seemed worth it, even if it just means I don't stress out about it. And then if your oxygen level is down, definitely to call your physician or to call the 911 if it's the middle of the night.
Thank you. And there are no more questions in chat at this time.
Nina, are there anybody has raised their hand yet?
I do not see any hands raised.
So we do have another question.
Yeah, there was one question I think I didn't answer that we got earlier, Jeff,
Yeah.
right? About VNA and hospice. Yeah.
Yeah.
So
go ahead and do that one, and I'll come back to another question
Okay.
in here.
Terrific. So in terms of home care and hospice, so home care does require a referral from a physician. If somebody is discharged from the hospital, they get it from there. If home care is needed, just call your primary care or your specialist if you're seeing a specialist like a cancer doc. In terms of hospice, you can get a referral from a physician, but you can also get what we call sort of an introductory meeting if you want to talk to somebody from hospice about what the services are and figure out if it seems like something that makes sense for you or your loved one. And we'll make sure to get the contact information about who to call if that's something that people want to access.
So Joanne, in chat, someone has expressed concern about many people not wearing masks and knows the city is going to be distribute them and wondering what the timing is. Like, what's the process for that?
So I can tell you that we have actually worked very closely with the city to help them have the masks to be able to distribute, because it's a lot easier for people to drop them off with us, and then we can launder them, and then we've given to the city to distribute. I thought, Jeff, that they were already distributing them and you just reach out to the public health department of the city. Is that your understanding?
That is my understanding. You can reach out to the health department and put your name on a list. I believe there may be more requests for masks than we have to hand out. So it may take a little bit of time to work through that. There is another request to repeat the call center number, so let me do that. It's 1-888-554-4234, or you can always go to CooleyDickinson.org and you will find the COVID information as soon as you click on our website.
Okay, okay, well, we did really well on timing. You couldn't. Oh, Diane, yes.
Jeff, I just sent you a couple of questions that came in via our website.
Okay, here's one I got. Can someone get COVID 2 times or more?
Again, nobody is quite sure. In general, people assume that they can't, but there seems to maybe have been times when they have. So it's just one more thing that people will have to study and research over the next several months. Usually with these kinds of viruses, the answer would be no.
So Diane, I don't see more questions unless one more's coming.
May I just go ahead and ask them?
Sure.
One that
Definitely.
came in via our website is if one is very sick with COVID and chooses to die at home, what services are available for hospice care or visiting nurse pain management? Did you sort of touched on that earlier? Is that?
Yeah, but I should be clear that we are continuing to do all of our VNA and hospice services, some of them by video and phone, but we do, when needed, our staff is going out to do the visits necessary. So just like outpatient care, people should know that the care is there. It just may feel and look differently, but it's not that we're not providing that care.
And then the other one is, you've already addressed the visitor policy, but I think this one is very specific to if someone is a COVID patient who is at end of life. Is there any provision for family to come in at end stage?
There is a provision. It is limited to 1 person, and also has to make sure that there's not too many people in the room at any time so that they can social distance. But yes, we are absolutely, and they can just talk to their doctor or nurse about that.
Thank you.
Another question has come in chat, and that is, will people be able to easily get a flu shot in the fall?
I don't know. I haven't heard that there'll be any issue, and we usually have plenty of flu shots to go around. Usually we're trying to encourage everyone to get them, but I do hope that that people all get them now, and we don't have to convince people on what the utility is. So certainly we'll need more of them, but I don't know. We will see if anyone's been concerned about the availability of it.
Do you know the percentage of people on vents who survive?
I don't know that. I do know that that people certainly are surviving. Lots of people are discharged out of the hospital with COVID, more than people who die, and people who have been on vents absolutely survive, but I don't know the specific numbers.
Okay, is that it then? I think we are ready to get a close to this. I can't personally thank you, both Jeff and Joanne, for your giving us these 30 minutes of your very valuable time now. I'm just thinking some of us have so much background with Cooley Dick. 70 years ago, I was born in Cooley Dick.
You're a Cooley baby.
I am, and my 3 children were born there, and that's another story in itself. And I held my mom's hand when she died in Cooley Dick.
Oh.
I've never ever been more proud of my ever, and the wonderful, committed energy in this horrible crisis. What I'm going to ask I think everybody's been demuted, and yeah, because it's getting really noisy. Just want to, and I want at this point, we don't have any big tenements to yell or say,
Frustrating.
bang our but I'd like
Just a minute,
everyone
Linda,
on
just
this
a minute.
call now, that 30. Staff at Cooley. Let's mute us now.
Thank you.
Thank
We will,
you, and everyone stay safe.
Tell me if my list is too long.
we will pass that on to the staff. Thank you.
Oh, please feel free to tell me.
All
Hey,
right.
take something off of this list, Linda.
This is why we can mute.
Thank you.
Thank you.
Thank you.
Have a good weekend.
Thank you. Thank you.